you definitely not be on if you're getting a tattoo? The science version. So I love me a theme, and I'm about to go finish my psychoactive octopus tattoo. And so I was very curious about if there's any recommendations for things that you definitely should not take before getting a tattoo. So there's suggestions of like, oh, make sure that you like have a banana or drink enough water. And then there's a whole thing about the pain relieving creams, the like numbing creams. I'll get into that later. But in general, there are some suggestions about things that you should and shouldn't be on based on like the pain and the experience of getting a tattoo. So which ones are actually backed by science? Now, first, when I asked this question to the actual tattoo artist, basically everybody had one answer, and that answer was alcohol. And that is a thing that seems to be standard across the world. Like, we actually see that there are health codes in place to make sure that people who are drunk are not getting tattoos, but also make sure that your tattoo artist is not drunk while tattooing you as well, because that's very important. So there are a number of reasons why alcohol is particularly bad if you're getting a tattoo. First, it is a blood thinner, and blood thinners mean that you are going to bleed more when you get a tattoo. Like, bleeding is something that just occurs during this process, and what we see is that if you bleed more, you're at an increased risk for infections, and I'll get into how likely those are later. But also in general, the tattoo artist is going to have to like wipe your skin off more often, and sometimes it's a little bit harder to see the design. This is also why they do not recommend things like aspirin or even things like ibuprofen before getting a tattoo. So aspirin definitely is a blood thinner. We see that ibuprofen has some of those properties as well. So it does prevent clots. So it could be problematic, although there's, again, no evidence out here on this. So the actual science is kind of ridiculously non-existent. Even for something like alcohol, which we have literal rules against, there is no actual study that's looking at things like alcohol and how it changes the process of having a tattoo or the healing from a tattoo. So who actually knows if ibuprofen is actually that bad? But they do suggest that acetaminophen might be fine. Acetaminophen is not a blood thinner, but we do see that just in general, a lot of things contain acetaminophen, and in general, you can easily overdose on acetaminophen, so make sure you're checking your doses. But also the blood thinning properties of alcohol, not the only part that's bad. So it seems like it might change your ability to make decisions. So you might end up with that like jug of piss tattoo that you were asking people on these tattoo subreddit about if you should get, which the answer is always no to a jug of piss tattoo. So alcohol could impair your judgments, although most of the scientific research on this says that it impairs more of your moral judgments, and I can go on that in an entire video if you want me to, but it doesn't seem to impair things like impulsivity or like overall decision making, like if you should get a tattoo or not. So that one's still up for debate. There are some studies that suggest that it might increase impulsivity, some studies that say only like social decision making. We're not sure yet. But in general, we do know that drunk people sometimes make terrible decisions, and if a tattoo is a permanent thing that you get on your body and you're gonna have to look at every day, you might want to make a good decision about that. And your tattoo artist also wants you to make a good decision about that. So that's why they have things like informed consent, where you sign a waiver when you get your tattoo. But if you're drunk, specifically if you're incapacitated, you can't legally sign a waiver. Now, what about other things? So we've covered alcohol, but what about things like skin medication? We do see that Accutane could be very problematic for people getting a tattoo. It might make the healing process be delayed, and it might lead to like these patchier tattoos. You can see this in the picture. And we see that like antibiotics might delay the healing process too, but that's pretty much it. Like, we haven't looked at any other drugs really when it comes to tattooing. Now, there are things that I probably wouldn't recommend based on my knowledge. So my personal anecdote is that when I take certain medications like Imitrex, which is a drug to treat my migraine, what happens is that, my skin starts to feel on edge. Like, my nerves are actually more sensitive. And so I am very sensitive to pain then. Also, I would not recommend things like Coke or meth because they make you jittery, and your only goal as a person getting a tattoo is to just sit there as still as possible for these hours. So yeah, it kind of prevents you from doing the one thing that you're meant to do. When I was talking about this at my tattoo studio the last time, somebody mentioned getting a tattoo on acid, which personally, I don't like that idea, but they said it was a small tattoo and it was fine. And supposedly benzos just make you too tired to be able to appropriately understand the aftercare instructions, which that's wild as a concept to me. I don't think benzos will prevent you from, leaving the Saniderm on and then not putting your tattoo in the sun and then wearing sunscreen, which is just a thing that you should be doing for the rest of your life anyway. So I don't know why benzos would make it that much harder for you to figure those things out, but supposedly it does, according to some websites. But not the scientific sources, because we have basically nothing there. Now, what about things like numbing creams? Numbing creams is a controversial issue. So, there are some artists who actually prefer that their people do not use numbing creams, specifically because it might actually change your skin texture and make it harder for them to tattoo. Lidocaine numbing creams that people have been using have had kind of too much lidocaine in them. So, above a normal amount that they're supposed to have, so above the 4%. And you add on to that typically people will put like Saniderm on top of your tattoo when it's done. Some people will wrap it in plastic wrap. I don't know where that one came from. Putting on a huge amount of pain relieving cream and then like wrapping it in plastic is probably not best case scenario. And so there have been some adverse effects like increased heart rate problems associated with using too much numbing cream. And then there's this one Italian study, which was, yeah, a bit difficult to read. I don't know if it's because of the actual like interpretation of it. They kept using the word anesthetics instead of analgesics, and they basically ended with this like, yes, and these contaminated inks that we tested because we thought they were contaminated did end up being contaminated. And so everybody who's getting a tattoo should be worried about unwittingly getting a dangerous amount of anesthetics and a dose of ink that potentially doesn't even go through drug safety. Like it was like wildly inaccurate. So yeah, probably don't worry about inks that much. So there's that one weird study, and there's this one study that said that, like, yeah, they might have a decent amount of bacteria in it, but only in like a small percentage of inks, maybe. But then there's also this big study that was like, but how many people end up actually getting infected? And what they found was that there is stunning 67 cases from 1984 to 2015 in terms of infections. But yeah, infections are relatively rare from tattoos, and you can typically tell if that tattoo studio is going to be good or not. Watch what they're doing. Do they have gloves? Are they appropriately sterilizing things? Do not get tattoos in your friend's basement. Those are the ones that are going to likely end up infected, not the ones from actual reputable tattoo sources. So yeah, some drugs are probably bad. Alcohol being the main one, other blood thinners. Most of them don't seem to be that terrible. But there's a lot of unknown here. So if you're a tattoo artist or a tattoo fiend, let me know if you have stories about drugs and alcohol with tattoos and what you've seen so that we can better figure out what to research in the future.